Medical Surgical Nursing Exam 6. Question 1. A client with myasthenia gravis asked the nurse why the disease has occurred. The nurse bases the reply on the knowledge that there is A. A genetic in the production acetylcholine. B. A reduced amount of neurotransmitter acetylcholine. C. A decreased number of functioning acetylcholine receptor sites. D. An inhibition of the enzyme leaving the end plates folded. Answer: C. A decreased number of functioning acetylcholine receptor sites. Question 2. A client with an inflamed sciatic nerve is to have a conventional transcutaneous electrical nerve stimulation TENS device applied to the painful nerve pathway. When operating the TENS unit, the nurse should A. Maintain the same dial setting every day. B. Turn the machine several times a day for 10 to 20 minutes. C. Adjust the TENS dial until the client perceives pain relief and comfort. D. Apply the color-coded electrodes anywhere it is comfortable for the client. Answer: C. Adjust the TENS dial until the client perceives pain relief and comfort. Question 3. Although no cause has been determined for scleroderma, it is thought to be caused by A. Autoimmunity. B. Ocular motility. C. Increased amino acid metabolism. D. Defective sebaceous gland formation. Answer: A. Autoimmunity. Question 4. The nurse must help the client with pemphigus vulgaris deal with the resulting A. Infertility. B. Paralysis. C. Skin lesions. D. Impaired digestion. Answer: C. Skin lesions. Question 5. The nurse should explain to the client with psoriasis that treatment usually involves A. Avoiding exposure to the sun. B. Topical application of steroids. C. Potassium permanganate baths. D. Debridement of necrotic plaques. Answer: B. Topical application of steroids. Question 6. The nurses should assess a client with psoriasis. A. Pruritic lesions. B. Multiple petechiae. C. Shiny, scaly lesions. D. Erythematous macules. Answer: C. Shiny, scaly lesions. Question 7. A urine specimen for ketones should be removed from a client's retention catheter by A. Disconnecting the catheter and draining it into a clean container. B. Cleansing the drainage valve and removing it from the catheter bag. C. Wiping the catheter with alcohol and draining it into a sterile test tube. D. Using a sterile syringe to remove it from clamped, cleansed catheter. Answer: D. Using a sterile syringe to remove it from clamped, cleansed catheter. Question 8. Following an abdominal cholecystectomy, the nurse should assess for signs of respiratory complications because the A. Incision is in close proximity to the diaphragm. B. Length of time required for surgery is prolonged. C. Client's resistance is lowered because of bile in the blood. D. Bloodstream is invaded by microorganisms from the biliary tract. Answer: A. Incision is in close proximity to the diaphragm. Question 9. The nurse assessed the client with cholecystitis for the development of obstructive jaundice, which would be evidenced by A. Inadequate absorption of fat-soluble K. B. Light amber urine, dark brown stools, yellow skin. C. Dark-colored urine, clay-colored stools, itchy skin. D. Straw-colored urine, putty-colored stools, yellow sclery. Answer: B. Light amber urine, dark brown stools, yellow skin. Question 10. A client with cholelithiasis experienced discomfort after ingesting fatty foods because A. Fatty foods are hard to digest. B. Bile flow into the intestine is obstructed. C. The liver is manufacturing inadequate bile. D. There is inadequate closure of the ampulla of Bader. Answer: B. Bile flow into the intestine is obstructed. Question 11. The chief complaint in a client with Vincent's angina is A. Chest pain. B. Shortness of breath. C. Shoulder discomfort. D. Bleeding oral ulcerations. Answer: D. Bleeding oral ulcerations. Question 12. Clients with fractured mandibles usually have them immobilized with wires. The life-threatening problem that can develop postoperatively is A. Infection. B. Vomiting. C. Osteomyelitis. D. Bronchospasm. Answer: B. Vomiting. Question 13. As a result of fractured ribs, the client may develop A. Scoliosis. B. Paradoxical respiration. C. Obstructive lung disease. D. Herniation of the diaphragm. Answer: B. Paradoxical respiration. Question 14. A client has a bone marrow aspiration performed. Immediately after the procedure, the nurse should A. Position the client on the affected side. B. Begin frequent monitoring of vital signs. C. Cleanse the site with an antiseptic solution. D. Briefly apply pressure over the aspiration site. Answer: D. Briefly apply pressure over the aspiration site. Question 15. Following a bilateral lumbar sympathectomy, a client has a sudden drop in blood pressure but no evidence of bleeding. The nurse recognizes that this is most likely caused by A. An inadequate fluid intake. B. The after effects of anesthesia. C. A reallocation of the blood supply. D. An increased level of epinephrine. Answer: C. A reallocation of the blood supply. Question 16. The occurrence of chronic illness is greatest in A. Older adult, B. Adolescents, C. Young children, D. Middle-aged adults. Answer: A. Older adult. Question 17. A client with full-thickness burns on the chest has a skin graft. During the 1-24 hours after a skin graft, care of the donor site includes immediately reporting A. Small amount of yellowish green oozing, B. A moderate area of serous sanguineous oozing, C. Epithelialization under the non-adherent dressing, D. Separation of the edges of the non-adherent dressing. Answer: A. Small amount of yellowish green oozing. Question 18. During peritoneal dialysis, the nurse observes that drainage of dialysate from the peritoneal cavity has ceased before the required amount has drained out. The nurse should assist the client to A. Turn from side to side, B. Drink 8 ounces of water, C. Deep breathe and cough, D. Periodically rotate the catheter. Answer: A. Turn from side to side. Question 19. A client has ear surgery. An early response that may be associated with possible damage to the motor branch of the facial nerve is A. A bitter metallic state, B. Dryness of the lips and mouth, C. A sensation of pain behind the ear, D. An inability to wrinkle the forehead. Answer: D. An inability to wrinkle the forehead. Question 20. After prostatectomy, a client complains of painful bladder spasms. To limit these spasms, the nurse should A. Administer a narcotic every 4 hours, B. Irrigate the Foley catheter with 60 ml of normal saline, C. Encourage the client not to contract his muscles as if he were voiding, D. Advance the catheter to relieve the pressure against the prostatic fossa. Answer: C. Encourage the client not to contract his muscles as if he were voiding. Question 21. After 1 week, a client with acute renal failure moves into the diuretic phase. During this phase, the client must be carefully assessed for signs of A. Hypovolemia, B. Hyperkalemia, C. Metabolic acidosis, D. Chronic renal failure. Answer: A. Hypovolemia. Question 22. The nurse checks for hypocalcemia by placing a blood pressure cuff on a client's arm and inflating it. After about 3 minutes, the client develops carpopedial spasm. The nurse records this finding as a positive. A. Holman's sign, B. Romberg sign, C. Kvostek's skin, D. Tross's sign. Answer: D. Tross's sign. Question 23. A client is scheduled for a below-the-knee amputation of the right leg. Legally, the client may not sign the operative consent if A. Ambivalent feelings regarding operation are present, B. Any sedative type of medication has recently been administration. C. A discussion of alternative with two physicians have not been performed and recorded. D. A complete history and physical have not been performed. Answer, B. Any sedative type of medication has recently been administration. Question 24. The nurse is assigned to check a client's continuous bladder irrigation. Which one of the following solution is normally used for continuous or intermittent bladder and catheter irrigations? A. Hydrogen peroxide. B. Bacteriostatic water. C. Sterile normal saline. D. Plain water. Answer, C. Sterile normal saline. Question 25. When continuous bladder irrigation is used following prostate surgery, the rate of flow is adjusted. A. To run at 60 drops per minute. B. According to the client's oral intake. C. To maintain an output of 500 milliliters every 8 hours. D. To keep the drainage to light pink. Answer, D. To keep the drainage to light pink. Question 26. The nurse is assigned to teach a class in health behaviors to young men. Which of the following can be stated as a probable cause of cancer of the penis? A. A diet high in acidic foods. B. Poor personal hygiene. C. Exercise. D. Circumcision. Answer, B. Poor personal hygiene. Question 27. The nurse is assigned to give perineal care to an uncircumcised male client. Which of the following is correct? A. The anal area is washed at a separate time. B. The foreskin is retracted and the area beneath the foreskin is cleansed. C. The foreskin should not be retracted except by a physician. D. The scrotum is carefully washed with sterile normal saline. Answer, B. The foreskin is retracted and the area beneath the foreskin is cleansed. Question 28. A female nurse is assigned to obtain a history from a client with urinary tract problem and sexual dysfunction. Which of the following statements might place the client more at ease and willing to give a history of his problem? A. When did you first notice this problem? B. Why do you think you have a problem? C. Do you think your sexual dysfunction is psychological? D. Does your sexual dysfunction seem to be related to your urinary tract problem? Answer, A. When did you first notice this problem? Question 29. A client is scheduled for an ultrasound examination of the prostate. To describe the procedure to the client, the nurse should plan to relate that A. The procedure is performed using a cystoscope. B. A probe will be inserted into the rectum. C. A flat disc is placed on the abdomen. D. This procedure uses X-rays to produce a visual image. Answer, B. A probe will be inserted into the rectum. Question 30. To effectively teach men the importance of testicular self-examination, the nurse should know that testicular carcinoma A. Rarely metastasizes. B. Has a high incidence of early metastasis. C. Cannot be detected by laboratory tests. D. Must first be biopsied to confirm the diagnosis. Answer: B. Has a high incidence of early metastasis. Question 31. A nurse is assigned to instruct a client in the method of testicular self-examination. The instruction should include mention that the best time to perform this task is A. Immediately after getting out of bed in the morning. B. Immediately before going to bed. C. In the morning after breakfast. D. After a warm bath or shower. Answer: D. After a warm bath or shower. Question 32. Mr. Dorn has vasectomy. He asks the nurse why he just used a method of birth control because today he had a sterilization procedure. The most correct answer is A. The sperm count will not be negative until his testosterone level decrease. B. Some minor surgery usually is necessary to ensure sterilization. C. Some live sperm will be present in the ejaculatory fluid for a period of time. D. Even though a vasectomy is performed, a condom is still recommended for 1 to 2 years. Answer: C. Some live sperm will be present in the ejaculatory fluid for a period of time. Question 33. A client is scheduled for a cystectomy and asks the nurse what the physician will be able to see during the procedure. The most correct reply is the A. Kidney and ureters. B. Bladder and rectum. C. Prostate and ureters. D. Urethra and bladder. Answer: D. Urethra and bladder. Question 34. A client is scheduled for a cystectomy and asks the nurse what the physician will be able to see during the procedure. The most correct reply is the A. Kidney and ureters. B. Bladder and rectum. C. Prostate and ureters. D. Urethra and bladder. Answer: D. Urethra and bladder. Question 35. Nurse assistant attending a nursing conference hears that one of her clients has hydrocele. She asks the nurse how this condition is treated. The most common response is A. Usually the problem requires more medical or surgical intervention. B. Surgery may be necessary to correct the problem. C. Wearing a scrotal support usually corrects the problem. D. Drug therapy usually helps control the collection of fluid. Answer: B. Surgery may be necessary to correct the problem. Question 36. The nurse is participating in a health class for young women. One subject is cancer of the ovary. Which of the following statements is correct? A. Early symptoms of cancer of the ovary are vague. B. This type of cancer has a high cure rate. C. Chemotherapy is not used for treating ovarian cancer. D. The most prominent early symptoms is an irregular menstrual cycle. Answer: A. Early symptoms of cancer of the ovary are vague. Question 37. The nurse is asked to discuss the signs and symptoms of the vaginitis caused by the fungus Candida albicans with Miss Barrows. Which one of the following is the usual sign and symptoms of this infection? A. Pain high in the abdomen. B. Intensive vaginal and perineal itching. C. Decrease in urinary output. D. High fever. Answer: B. Intensive vaginal and perineal itching. Question 38. The nurse prepares to give Miss Edwards a vaginal suppository, which is inserted by means of a special applicator supplied with a drug. Which one of the following is correct? A. Ask the client to void prior to inserting the suppository. B. Lubricate the tip of the suppository with petroleum jelly. C. Insert the applicator tip gently and with an upward and forward motion. D. Insert the applicator approximately 1/2 inch and depress the plunger. Answer: A. Ask the client to void prior to inserting the suppository. Question 39. The nurse is assigned to give Miss Milton perineal care. When cleansing the perineum, the cotton ball or washcloth is gently directed. A. Side to side across the labia majora. B. Downward from the pubic area to the anus. C. Upward from the anus to the pubic area. D. From the urinary meatus to the vagina. Answer: B. Downward from the pubic area to the anus. Question 40. The nurse is assigned to administer a vaginal irrigation douche. Which of the following is correct? A. The irrigation is best administered with the client standing in a bathtub. B. Before inserting, the nozzle is lubricated with petroleum jelly. C. The temperature of the solution should be between 80 degrees Fahrenheit and 84 degrees Fahrenheit. D. The nozzle is inserted downward and backward within the vagina. Answer: D. The nozzle is inserted downward and backward within the vagina. Question 41. The nurse is assigned to teach health-seeking behaviors to young women. One topic the nurse plans to include is the importance of the Pap test, which is used mainly to detect A. Ovarian cyst. B. Patency of the fallopian tube. C. Cervical cancer. D. Uterine infections. Answer: B. Patency of the fallopian tube. Question 42. The physician asks the nurse to position a client for a vaginal examination. Which of the following position is normally used for this type of examination? A. Lithotomy position. B. Sims position. C. Dorsal recumbent position. D. Left lateral position. Answer: A. Lithotomy position. Question 43. Miss Hull has had an electrocauterization of her cervix for chronic cervicitis. Following the procedure, the nurse should instruct Miss Hull to A. Douche the next day to remove debris and blood cloth. B. Avoid straining and heavy lifting until the physician permits this activity. C. Stay in bed for the next 5 days. D. Return in bed for the next 5 days. Answer: B. Avoid straining and heavy lifting until the physician permits this activity. Question 44. The nursing assistant is assigned to give Miss Bailey, who has had an abdominal hysterectomy, a sitz bath. She is instructed to use the special sitz bathtub. She asks the nurse why the regular bathtub cannot be used. The most correct reply is based on the fact that a regular bathtub A. is more slippery and is dangerous when used for surgical clients. B. cannot supply water that is of the desired temperature for this procedure. C. applies heat to the legs and alters the desired effect of heat directed to the pelvic region. D. cannot be kept as clean as a special sitz bathtub. Answer: C. applies heat to the legs and alters the desired effect of heat directed to the pelvic region. Question 45. Which of the following solutions would be best for the nurse to use when cleaning the inner cannula of a tracheostomy tube? A. Isopropyl alcohol. B. Sodium hydrochloride. C. Hydrogen peroxide. D. Providon iodine. Answer: C. Hydrogen peroxide. Question 46. The nurse observes that the client's knee is swollen and painful. Consequently, which one of the following nursing measures should be carried out? A. Perform passive range of motion during each shift. B. Help to change positions to achieve comfort. C. Ambulate with him at frequent intervals. D. Encourage quadriceps setting exercises. Answer: B. Help to change positions to achieve comfort. Question 47. If Miss Drake tells the nurse her feet are cold, which of the following nursing action would be best? A. Apply a hot water bottle. B. Use an electric heating pad. C. Wrap them in a warm blanket. D. Elevate her feet on a stool. Answer: C. Wrap them in a warm blanket. Question 48. Which of the following would indicate to the nurse that the stationary thrombus in Miss Fleming suddenly develops? A. Chest pains. B. Leg cramps. C. Numbness in the foot. D. Swelling of the knee. Answer: B. Leg cramps. Question 49. Following a total abdominal hysterectomy, Miss Sara Fleming develops a slightly elevated temperature and swelling in the right call of her leg. The physician prescribes warm moist compresses for the client's affected leg. Which of the following nursing actions is correct when applying the warm moist compress? The nurse: A. Heats the water to 120 degrees Fahrenheit. B. Uses a sterile technique. C. Inspect the skin every 4 hours. D. Covers the wet gauze with a towel. Answer: D. Covers the wet gauze with a towel. Question 50. Miss Betty Lynch, age 29, holds that she has recently developed a skin problem and makes an appointment to be seen in a clinic specializing. Diagnosis of psoriasis is made by the physician. When examining Mr. Lynch's skin for areas of psoriasis, the nurse should look for: A. Weeping lesions on the trunk of the body. B. Patches of redness covered with silvery scales. C. Areas of redness surrounded by crusts. D. A rash characterized by raised, pus-filled lesions. Answer, B. Patches of redness covered with silvery scales.
Thanks for watching. Please comment, like and share.